Hi everyone. Today we are going to see few more questions from Muscles and Neuromuscular Junction chapter in physiology. So moving on to question number 1. Calcium ions triggers muscle contraction by binding to, they've given 4 questions: A. Actin, B. Myosin, C. Troponin, D. Tropomyosin. The answer to this question is C. Troponin. The muscle contraction is basically initiated when large number of calcium ions bind with the troponin C. So this calcium ions is the main link, or you can say it is a bridging agent, or it is like a coupling agent between the excitation and the contraction of the muscle. So this is basically done with the help of it binding to the troponin. Moving on to question number 2. Contractile element in myofibril is A. H-band, B. sarcoplasm, C. sarcomere, D. A-line. The answer to this question is C. sarcomere. Moving on to question number 3. The following electrodes are used to detect the muscle activity without pain. They've given 4 options: A. surface electrode, B. round electrode, C. hook electrode, D. needle electrode. The answer to this question is A. surface electrode. Moving on to question number 4. The study of the electrical activity of the muscle is, they've given EEG, EMG, Venn diagram, and then ECG. The answer to this question is B. EMG, which is electromyography. Moving on to question number 5. In an isotonic contraction of the muscle, they've given 4 statements. A. The muscle moves a load through a distance. B. The muscle is not able to move the load. And then C. The latent period of contraction is shorter than isometric contraction. And then D. The length of muscle is increased. The answer to this question is A. The muscle moves a load through a distance. So, if you see in an isotonic contraction, the tension is going to remain the same, but the muscle is allowed to shorten during the contraction. So, when this happens, technically there is going to be an external work which is to be done there by the muscle as such. So, this is called as load is lifted. So, in case of an isotonic contraction, the tension is going to remain the same, but then there is going to be a small shortening of the muscle during this contraction. But wherein your isometric contraction, the tension is increased. It's not going to remain the same. And the muscle is prevented from shortening. So the external work is actually 0. There it happens in isotonic, but then here in isometric it does not happen. So since here the question is about the isotonic contraction, the option A is correct, that is the muscle moves the load through a distance. Moving on to question number 6. Tendon or ligament is attached to a bone through, they've given 4 options: the Toombs fibers, B. interstitial fibers, C. Sharpie's fibers, and D. Haversian fibers. So the answer to this question is C. the Sharpie's fibers. Moving on to question number 7. In myasthenia gravis, they've given 4 options: A. There is lack of acetylcholine, B. lack of acetylcholine receptors, C. there is isometric contraction, D. the muscles are rigid and tough. The answer to this question is B. lack of acetylcholine receptors. So why this happens? So in case of, so what is this myasthenia gravis? See, myasthenia gravis is an autoimmune disease. So what happens is the body develops the antibodies to its own acetylcholine receptors. So the amount of the acetylcholine released from the body is actually normal. But then the body develops and then it destroys the acetylcholine which is released by its own acetylcholine receptors because of the antibodies which actually it possesses to its own acetylcholine receptors. So in some severe cases, there is also paralysis of muscles which happens. So the answer to this question is lack of acetylcholine receptor. That is the option B. So moving on to question 8. The neuromuscular transmitter released at neuromuscular junction is, they've given 4 options: A, dopamine, B, epinephrine, C, norepinephrine, D, acetylcholine. The answer to this question is D, acetylcholine. Moving on to question number 9. A motor unit is made up of, they've given 4 options: A, flexor muscle and an extensor muscle, B, a single skeletal muscle and all the motor neurons that supply it, C, a single motor neuron and all the muscle fibers it innervates, and D, all motor neurons in which responses are observed after maximal stimulation of a single sensory nerve. The answer to this question is C, a single motor neuron and all the muscle fibers it innervates. Moving on to question number 10. Non-true regarding sodium-potassium pump is, option A, it pumps the sodium against a gradient. Option B, 5 sodium ions is exchanged for 2 potassium ions. The answer to this question is B, 5 sodium ions is exchanged for 2 potassium ions. So there is something called as a sodium-potassium pump, as we know. So what happens is, from one side there is going to be potassium ions coming, wherein from the other side there is going to be sodium ions coming. So they both are going to go in the opposite direction, facing each other. So now this process of its movement is induced or accelerated by an electrogenic pump. So this whole system is called as sodium-potassium pump. So now what happens naturally is 3 sodium ions will come out of the cell and 2 potassium ions will move inside the cell. So it is 3 sodium which is exchanged for 2 potassium. So the non-true option regarding your sodium-potassium pump is, in this options, whatever they have given in these options, it is B, 5 sodium exchange for 2 potassium, because it's only 3 sodium which is exchanged for 2 potassium. So thank you so much and hope you're going to read more and